Welcome back to RX Report Season 2. Nobody is more surprised than me that they brought me back, but it's 1 month into 2026 and it's not even close to the craziest thing that's happened. We're doing a deep dive this year, stepping out of the studio to do some even deeper stories into the world of pharmacy and pharmacy healthcare in the United States. Don't worry though, even though it might seem like I'm really far away from my fancy studio in front of Big Abe here, APhA is actually right up the street, so no big worries. Anyway, today's topic. Shocking, the overloaded pharmacy healthcare system and ways that we can fix it. No, it's not AI, GLP-1s, or grandma's apple pie this time. No, instead we need to talk pharmacy technicians, what they do, who they are, and how they could be the key to revolutionizing pharmacy care in the United States. To dive deeper in, I'm your host, Manuel. Let's get to it. As I'm out here risking my life, let me tell you something that all of the great newscasters start with, telling you something you already know. That's right, the greats. Walter Cronkite, Lester Holt, Ron Burgundy, now Manuel. Pharmacists are a jack of all trades, juggling more hats than that random guy at the Ren Fair. Between low staffing, skyrocketing demand, and a healthcare system that's stretched so thin it's ready to snap, there's obvious need for change. So that's a lot of problems. Where do we really go from there? Well, there's no one-size-fits-all Band-Aid that will really fix all of American healthcare's boo-boos. Pharmacy technicians could be a salve that's kind of been under our noses for a long time here. Technicians are kind of like the Garfunkel of the pharmacy world. They do a lot, but maybe don't necessarily get the credit they deserve, or at least people will argue they deserve. That Like a Spotlight may have you asking what even is the difference between a pharmacist and a pharmacy technician. Well, buckle down, Sonny Jim, I've got the definition right here for you. So, pharmacists study medications at the graduate level. So something like 4 years of postgraduate degree, training labs, and direct patient care. Now, that training prepares them for evaluating drug therapy, tailored treatment plans, prevent interactions, perform clinical testing, and vaccinate. Technicians are trained to carry out the operational, technical, and support functions that allow pharmacies to serve patients smoothly. Depending on the state, that includes formal training, certification, and registration. They fill prescriptions, manage inventory, handle data entry, support medication reconciliation, and may assist with giving vaccinations alongside other pharmacists. Turns out, until about 10 years ago, technicians were kept as more assistants than actual technical leads. Over recent years, different states have expanded technician scopes to allow them to support every step of the medication use process, growing from an assistant to an actual vital part of the pharmacy ecosystem. But here's a twist. Despite technicians' clear benefit to pharmacy practices, many are not really used to their full capabilities, training, and expertise. Pharmacists that are chugging Red Bull like their life depends on it could have a perfectly good technician there to help offset some of the load. Pharmacists have also been wary of allowing technicians to expand their practice, therefore kind of keeping pharmacists themselves more overworked by their own design. A 2021 Journal of the American Pharmacists Association study found that only 24% of pharmacists surveyed were comfortable with technicians being allowed to administer vaccines, a task that they were given authorization to perform following certificate and hands-on training via a temporary emergency preparedness program during the COVID pandemic. Many states have made this temporary authorization permanent, which allows the pharmacist time to conduct clinical oversight of the technician performing technical tasks. We've got more to talk about, but first, a quick note on APhA 2026. Early bird pricing is about to end and you need to get your tickets now. Get that good pricing and make sure that you get to the APhA annual meeting in LA March 27th to the 30th, happening this year. Check out the QR code or go to the link in the description to learn more. Here to talk about where the technician field is headed and the exciting progress happening, we have Julie Lanza joining us remotely. She's the first pharmacy technician ever to serve on APHA's Board of Trustees. Julie is an advanced certified pharmacy technician and director of training and education at the Beth Israel Lahey Health, with nearly 3 decades of experience shaping what technician practice looks like today. Julie, thank you so much for being on the show. And really, let's just start off with a kind of surface level question. How long have you been a technician?
I have been a pharmacy technician for 29 years, nationally certified through PTCB for 27.
And what impact have you personally seen when technicians are empowered to do more patient-facing work?
The impact is nothing but positive. I could give you an example if that's okay. We'll go back about 6 years. COVID, not a lot of states were allowing pharmacy technicians to administer vaccines. It was very few before COVID due to the necessity and the need for help, mostly because pharmacists needed to be patient-facing. We saw a lot of states enact policies that, technicians could vaccinate just during the emergency order, but now it's forever. So when you put technicians in patient-facing roles that they are qualified for, either technical or operational, you see the positive impact from one end to the other. And that's the biggest one I've seen in the past 10 years, is that we have all these surprising, people coming out saying that I can't believe how many technicians stepped up.
What's the biggest barrier preventing technicians from working at the top of their skill set?
So I think one of the biggest barriers, this is a twofold answer, a personal and a professional answer for me. So professionally, I think the biggest barrier is there is zero standardization for pharmacy technician licensure and regulatory scope state to state. Every state does their own thing. Some states require techs to be certified. Some are just registered. Some are this, some are that. I think there's no standardization. So I think a lot of the barriers rely within the state. Some states are afraid to expand the scope because they're not sure it will work. Some will just expand the scope and see what works and what doesn't work and tweak it as they go. So I think state to state and the lack of standardization, the lack of licensure, the lack of education, it's just very much 51 different ways that technicians can do things based on the state you're in. I think that's one big thing. From a personal standpoint, I think the other big thing is, with all due respect, I think it's people. I think there's always going to be a handful of people out there that don't feel as though technicians should be doing more than they're doing. They're not qualified. They're not educated enough. I think it's some people are old school. Some people are stuck in their ways. And I think historically, technicians were hospital glorified delivery person, retail pharmacy glorified cashier, and that is absolutely not the way right now. And I think that some people in their, strong-willed sense of how things should be is kind of holding technicians back a little bit. Technicians are not here to take a pharmacist job. There's a lot of technicians that are fully educated, have college degrees, but they didn't choose the clinical pharmacy route. They didn't want to do clinical pharmacy. They wanted the operational task. That doesn't mean we're not educated. It means that any technical and operational task should be given to a technician, and nobody should be worrying about what jobs we're going to take. I think it just needs to be something that people have to be a little bit more open-minded about.
Do you think your job changing has been a help to pharmacy and or patients?
So technicians overall, if you look, and you could look at the national stuff, technicians overall are doing more technical work. So we see technicians in diversion analyst roles. It's a lot of diversion analyzing. It's a lot of diversion investigating. You don't have to be a pharmacist. We see a lot of technicians in a lot of sterile compounding oversight roles. They're overseeing clean rooms. We see a lot of technicians in the 340B space. These are all things that technicians can do. So then pharmacists, as they go through 6 years of pharmacy school and however many years of residencies, they go to school to focus on the clinical aspect, to focus on the patient facing, to focus on order sets, to focus on therapeutic duplications, to focus on allergies, to focus on that. Putting technicians in advanced and elevated roles, which I am a huge advocate for, developing them, creating them, supporting them, advocating for them, putting technicians in those roles takes things off the pharmacist's plate. There could be a pharmacist who's working med safety and wants to be a med safety pharmacist patient facing and wants to deal with the patient safety part of med safety, but here they are in a med safety role and have to deal with all the drug diversion stuff. Well, if you can get creative and create these roles and develop these roles and put technicians in these roles, then I think it creates a whole different world for pharmacists to focus on what they want to do. What we do, and I will tell you personally, what we do is we don't necessarily write a generic job description for an advanced elevated technician role. We don't write job descriptions to fit the technician. We want the technician to fit into the job description. So we write the job description as not a generic. We expect a lot. We put a lot of qualifications into it, and you get what you ask for. And we have a lot of high-level roles. But I think anything a technician can do that can take some stuff off of a pharmacist's inundated, stressed, burned-out plate has been helpful, no matter what area of pharmacy you work in.
Okay, so if you look 10 years ahead, what do you think the technician role becomes, and what really does pharmacy look like if we don't evolve?
I think one of the biggest things is I would like to see in 10 years all of the states adopting certain practices. Technician product verification is one of them. A handful of states do it. We call it 13 different things in 13 different states. But I think technician product verification is a big one. It takes the pharmacist out of the actual simply matching a label to an item. I think also MedRec. I think a lot of people need to get technicians involved in medication reconciliation. A technician can sit and take information from a patient and understand, and a pharmacist wouldn't have to spend an hour for it. I think this aspects of the pharmacy technician advancement roles that should be, I'm hoping in the next 10 years, are accepted like nationwide, because I think state to state, that's going to help with the pharmacist stuff. I think if it doesn't happen, I think what we're seeing, and as a technician, I very much see it, and I feel for them. We have a lot of pharmacist burnout, and working in a large health system with hospital pharmacy, institutional pharmacy, specialty pharmacy, all the pharmacies you could think of, I see burnout in the pharmacists in every area of pharmacy. I think if this continues and technicians don't continue to advance, I think the burnout is going to get worse. I think the pharmacist shortage is going to continue to happen. You're not going to be able to get pharmacists. But I also think that it's not simple, but it's simple enough to say, are technicians a little piece of the solution to pharmacist burnout? Can technicians in your state, in your city, at your employer, at your institution, can technicians be part of the solution and stop looking backwards to when they, the mindset of they're part of the problem and we need to educate them? Isn't it? They are part of the solution. Advance them, elevate them, advocate them. And if you're not, and I think that if people are concerned about the level of advancement and the level of elevation for the technicians should or shouldn't be doing, my advice to them would be, if you're putting a technician in an advanced role and they don't do well, or they fail, or it's not successful, that's on you as an employer, because you didn't train them well as to what you want them to be doing.
To get a little bit more context on this issue, we're here at Grubbs Pharmacy, one of the last remaining community pharmacies here in Washington, D.C. We're going to go talk to one of the pharmacy owners about what it's like to work with technicians and their expanded abilities to help other pharmacists. Okay, so I'm here with Bill Fidel here at Grubbs Pharmacy. Bill, can you tell me a little bit about how long you've been managing pharmacists and technicians?
Wow. Hey, it's been more than 40 years, and I can't believe it's been that long.
Can you tell me a little bit about what they're able to do now with those expanded abilities?
Yeah. Pharmacy is always changing, and there's more coming, actually. So I have seen the change over the years. Technicians, through a lot of standardized training and learning more, become immunizers and take on more responsibilities. It really allowed the pharmacist to focus more on direct patient care and perhaps do more clinical work, if you will. So that was amazing.
So how do your fellow pharmacists feel about technicians able to do more and more so that they themselves can do more patient care, like you say?
Well, initially, obviously, some pharmacists have resisted that.
Sure.
It's natural. But once they saw the benefit of working with a trained technician that is able to do the day-to-day work, taking care of workflow, even supervising other technicians, allowing that pharmacist to have time to themselves so they can really focus on the patients and provide the direct patient care. And, with the more clinical work available in community pharmacy, especially, I think they all appreciate it, and I think that's what's happening.
So we've seen their abilities already expand in the past 10 years. In the near future, let's say the next 5 years, what would you like to see personally technicians able to do more of in that coming future?
Great question. I think there's a lot more that can be done. I can speak from my past experience. The more you coach, develop, train in a very standard way to teach new responsibilities, allow or provide the technician to be exploring new abilities and new roles. There's a lot more to come where we can, the pharmacy can become safer, pharmacists can do their work at ease, and they're able to take on more responsibility to improve healthcare anyway.
Like pharmacists and other clinicians, like nurses and primary care doctors, pharmacy technicians are getting hard to hire thanks to similar issues of burnout, low compensation, and a lack of defined career opportunities. This is despite the U.S. Bureau of Labor Statistics saying that there is a strong demand for technicians, with a 7% growth in job openings projected over the next 10 years. In terms of career opportunities, technicians are just starting to be added to state pharmacy boards to have a voice in how pharmacy is shaped. And APhA is actively offering resources to further empower technicians, like the CPHT training program and immunization certificate program. As it is, these positions are getting hard to fill despite the demand, and with pharmacy and all of healthcare professionals already kind of overworked, alarm bells are ringing on what the future holds. We've got more to talk about, but first, a quick note from our Pulse on Policy team. Brian, take us away.
Thanks, Mason, and Happy New Year, everyone. Today we're talking about the Rural Health Transformation Project. A provision in SB 1, also known as the One Big Beautiful Bill Act, allocated $10 billion per year for 5 years, $50 billion total, to empower states to strengthen rural communities across America by improving healthcare access, quality, and outcomes. Every state submitted detailed plans and was allocated money based on how the state's plans aligned with the program's goal of sustainable access, workforce development, and innovative care. Pharmacists have long been at the center of health in many rural communities. Patients rely on their pharmacist first because they are often the only healthcare provider in the area. Many patients often see their pharmacist more than their doctor. Working with state pharmacy organizations, APhA secured the inclusion of pharmacists and pharmacies in many of the state's applications for this funding. APhA has a new resource on our advocacy website that breaks down pharmacists' inclusion in the state applications. This resource can be found in APhA's Advocacy Issues website under the States tab or in the video description. Idaho, North Dakota, Ohio, and other states mention pharmacy innovations such as drone delivery, telepharmacy dispensing, and expanded meds-to-bed services. Other states, such as Alaska, Arkansas, and Michigan, specifically address alternative payment models for pharmacists or expanding pharmacists' scope of practice. This is exciting, as pharmacists have been stepping up as connectors in a fragmented rural health system. And pharmacists aren't just dispensing medications, they're conducting blood pressure checks, screening for fall risk, and managing medication regimens to prevent hospitalizations. With nearly 80% of older adults living with multiple chronic conditions, pharmacists are bridging gaps in rural healthcare. And with this newly allocated funding, pharmacists can continue to expand access to care in their local communities and fully showcase their education and training. Thanks. Back to you, Mason.
So here's the takeaway from your RX Report Season 2 premiere. Pharmacy technicians aren't support staff. They are essential pharmacy professionals and an invaluable part of the pharmacy team. And if they aren't given the tools they need to provide consistent care sustainably, they might be gone before we can fully appreciate them. So if we're going to fix the pharmacy crunch, maybe the answer isn't a new app or nightmare-fueling Tesla robot. Maybe it's the person beside the pharmacist who's been waiting to shine all along. On that hallmarky ending, what are your thoughts on healthcare today and the technician's growing role in it? If you're a pharmacist, how are you utilizing your technicians in your practice? Let me know in those comments. RX Report would be nothing without my people behind the curtain, including our executive producer, Rob Hodges, our videographer, Daniel Munoz, and our creative producer, Kate Erdmann. I've been your host, Manuel, and I'll see you next time. Till then, bye y'all.